It's it's very new technology. It's very interesting, but a lot of people worry about it in terms of a person's freedom. We're going to take a look at that, a very strong look at it.
I'm Julie Pace, Washington Bureau Chief for the Associated Press, and this is Ground Game. The coronavirus pandemic ranks among one of the most consequential stories ever covered by the Associated Press in its 170-year history. Here to take you inside the outbreak is AP's Ralph Russo.
From the Associated Press, this is Inside the Outbreak. I'm Ralph Russo. Today is Thursday, April 23rd. The coronavirus pandemic has Europe's economies heading for an unprecedented recession. EU leaders are expected to endorse a financial package of aid worth more than $587 billion very soon. Worldwide, the death toll is approaching 185,000 with 2.6 million cases. On this episode of Inside the Outbreak, we'll consider the intersection of health and privacy. Joining me on the podcast is Christina Larson. She is a global science and environment writer for the Associated Press. Christina delved into how new technologies are being developed to help track who is infected and who isn't, and where they've been. Some are already being used in parts of Asia. The challenge is achieving the tricky balance between limiting the spread of the disease and allowing people freedom to move outside their homes. Joining me on the podcast today is Christina Larson. She is a global science and environment writer for the Associated Press. Thanks for joining me today, Christina. So let's start here. After 9/11, there was a lot of debate in the United States about how much privacy citizens should be expected to concede in the fight against global terrorism. Why should we be prepared for similar conversations in the fight against the coronavirus?
Well, in most ways, fighting a pandemic is not like fighting global terrorism. But I think there is a useful analogy there in that a lot of the systems that were set up after 9/11 to reduce the risk of future terrorist attacks are still with us today. The checks at airports, some of the museums in New York, you can't take your bags in, things that were set up for a specific purpose tend to linger unless there's foresight in planning for them to have an expiration date. And so right now, most people I've talked to, whether they're scientists, technologists, folks who think about civil liberties, agree that there are going to be new systems that governments put in place to monitor who has been infected, who is infected, who might be most at risk for this new coronavirus. But the hope is that there can be a thoughtful conversation now to do this in a way that most protects people's privacy. So, for example, two things that I've heard often. The first is that information that's gathered for the purpose of public health should only be available to public health authorities. It shouldn't be sort of part of a permanent file that any government agency could be able to draw on. And the second thing that I've heard a lot of folks mention is that there should be an expiration date, that data that might be collected about your location while you've been infected or after you've been exposed to someone who's been infected is useful for time being, but it's not useful forever for public health purposes. And so that data should be wiped after a certain point.
So what is contact tracing, and what kinds of technology are either already being used or being worked on to fight the spread of the virus?
Traditional contact tracing, which is used to curb all sorts of infectious diseases, from tuberculosis to HIV, and now new coronavirus, is basically trying to figure out how the disease moves from person to person and find ways to break those chains of transmission. So, for example, if you've been infected, that would be interviewing you to ask, who did you meet last Thursday? All the people that you remember, where did you go? Who did you encounter? And what about for Friday and Saturday? To try to put together who you might have exposed. And then the people who are doing the contact tracing would then go to the contacts that you've provided and ask them where they've been, who they might have exposed. And so it's a real labor intensive process. And it's something that governments in South Korea and Taiwan, for example, ramped up very quickly when there were first incidences of this new coronavirus detected there. Now, today, several countries, including the United States, have folks who are looking at ways to augment this traditional contact tracing with some kind of digital or technology-enabled data sets. So, for example, Apple and Google in the United States have announced that they're building a sort of digital contact tracing app to be released probably sometime in May. So we don't know all the details yet. The idea, though, is that it would use Bluetooth technology to detect whose phone was within a certain radius of yours. I keep that information probably on your phone. And then if any of those people alert public health authorities that they've been tested positive, then this app would sort of, shuffle back through those numbers of who it's been in contact with. I don't know the details yet for this particular app, if that information will be provided to the individual or directly to public health authorities. But the idea is basically to augment traditional contact tracing. Now, there's been an app like that that is already in use in Singapore. This one was developed by the government. About 1 in 5 people downloaded it in the first couple weeks after it was released in March. And the people I've spoken with who use this app say they download it. It basically sits on your phone. It doesn't seem interactive. There's no maps or bells or whistles, but it's basically sniffing out who's been within a certain radius of you. I think it's about 9 or 10 meters for 20 or 30 minutes. Potentially the disease might have passed between two individuals with that degree of interaction. And then if one of you gets sick, that it is basically a tool that's used to help the humans who are still going to have to do the work of calling your contacts and tracking down how the disease might have spread. But it's a useful way to basically, it's like a cheat sheet, I suppose. It gives public health authorities some data to begin with when they're doing their work. So I think I should say there are other ways that technology is being talked about being used. For example, in Korea, there is an app that actually alerts people where someone who has been infected actually has been. So that raises a bit different privacy questions, might seem to some a bit more invasive to go down to sort of the individual movement level and having some degree of that information be public. The second question is really about interoperability between systems. If you have a whole bunch of different apps, to what extent do they share information with each other or with governments? And these questions aren't answered because this is really a sort of an experiment in the making, but lots of people are thinking about and pressing these technology companies for answers.
So you mentioned the technology companies. Which companies, between cell phones and GPS in our car and all the information that we regularly provide on the internet, it seems like the tech companies are already well positioned to do this. Which companies might be looking to get in the game here?
Well, in the United States, Google and Apple have announced that they're developing together, which is interesting because they're often seen as rivals, but they're developing together a contact tracing app, which would use Bluetooth technology to alert people who've downloaded the app if they've been in a certain vicinity or certain distance from other people who are known to have been infected. We don't know all the details yet because the idea is that this app would be available probably sometime in May, but it would be similar to an app that was already released in Singapore. That one was developed by the government. In India, at least one private technology company is developing its own app. So I think the advantage that these technology companies have, let's talk about Apple and Google in the US. I don't think that anyone who is thinking about privacy would want Apple and Google to scoop up all the information they already have about you, what music you listen to, where you go, what things you pull up on Google Maps, and integrate that into a contact tracing app. I think people would feel that was a unfair use of data that they already have. But obviously, these companies have a lot of expertise in software. They have a lot of expertise in making things that are user-friendly, and a certain amount of public trust. Of course, people have questions about policies of all companies, including these. But the idea is that if they develop something using their engineering expertise, that it would hopefully be a pretty good product. Again, these questions are coming up. If they're gathering information or aiding public health authorities gathering information about who's been infected and where they've been for the purposes of public health, civil liberties advocates and technology, academics are really urging the companies to make sure that that information is not shared across all levels of government, and certainly is not part of their, customer databases on you that would filter into what they recommend that you buy on iTunes or anything like that.
So you touched on this a little bit before, and my last question will be, we live in a time where we sort of have this expectation that technology will fix everything. And in reading your story, it seemed like there are some experts who are cautious about that approach here.
Absolutely. The one thing that I've heard over and over again is that technology can be a supplement to the important work that public health authorities are doing, but it can't be a replacement. In this case, the idea of a digital contact tracing app, first of all, it's only meaningful if you have enough availability of the coronavirus tests for people to know if they're positive, because that's the information that feeds into the system. And if the contact tracing app identifies that you've been in the proximity of someone who has this disease, it's one thing if it sends an auto-generated text alert to tell you to self-quarantine for 14 days or some other time period. But it's obviously, you still need people to do the hard work of talking to people about who their contacts are. If someone needs to be self-quarantined and they don't otherwise have an easy way to get groceries, for example, in Queens, New York, there's some effort to bring people, especially elderly people, groceries if that makes it easier to self-quarantine. So the data is something that feeds into and helps public health systems, but it's not a substitute for it. And I think that's true with a lot of aspects of technology in our lives. I mean, I think we're all living a lot more on Zoom lately, and it's great to be able to connect to people from a distance, but I don't think anyone thinks that this technology fully substitutes for in-person meetings, which I hope will be possible in the not too terribly distant future. So, technology is integrated into our lives. It makes things possible. It makes some things easier, but it's not a substitute for the offline aspects of public health or the rest of life.
Christina Larson is a global science and environment writer for the Associated Press. Christina, thank you so much for joining me today and providing some great insight. Please stay safe and stay healthy.
Thank you. You too.
At apnews.com, today's One Good Thing feature is a story about a young man and a 3D printer. Georgetown Day School senior Jonah Dr. Loeb sought a way to help doctors and nurses on the front lines of the coronavirus pandemic, tapping into an online community of makers, 3D printer enthusiasts. He found an open source design for a welder's mask style face shield that he could print at home and provide to hospitals seeing their supplies of protective equipment depleted. Print to Protect now includes a network of about 100 3D printers and has made 3,000 shields, with many more to come. Read that story and all of AP's coronavirus outbreak coverage at apnews.com.
That's it for this episode of Ground Game. We'll be here every step of the way during this extraordinary moment in American politics and American life, giving you all the news you need to know. Be sure to tell a friend about us, and please subscribe on Apple Podcasts and leave us a review. Some of the details of our discussion may have changed by the time you hear this. For up-to-date developments on all of your news, head over to apnews.com. From the Westwood One Podcast Network.